I'm going to make it darker so that you don't look at yourself the whole time. Everyone who's registered for post
Great. Copy. So, good morning, everyone. Geoff. So, let me introduce our distinguished speaker, Dr. Geoff Bates. Is a lecturer in public health policy at the Institute for Policy Research, University of Bath, And his research focuses on how to improve public health and reduce inequalities through tackling the wider determinants of health, such as the social, political, and economic factors that shape the conditions we live in. He is interested in the effective use of different types of evidence to influence preventative policy making and how to collaborate effectively across sectors and disciplines for impacting complex policy areas. Geoff currently works on projects seeking to embed health evidence into areas of upstream decision-making that shape urban environments and supporting government organizations to understand and tackle the negative impacts of businesses on health. And the title of Geoff's talk today is Humility, Positivity, Adaptability, and Resilience, making systems approaches and collaboration across disciplines and sectors work to tackle societal challenges. So as you can see, it brings in many of the concepts that our conference revolves around. And Geoff, the floor is yours. Thank you very much for being with us.
So much for the very kind introduction, and more broadly, really, for the invitation to be here today. I'm new first time at this conference, and really enjoyed my time yesterday, joining in some of the conversations and hearing the talks. Resisted the urge to make lots of changes to my own talk after listening to lots of other people yesterday. But yeah, it's been really nice to be here and just to be part of some of these conversations. So, well, the introduction's given you a good indication of what I do, what I'm interested in, and what I'm going to be talking about today. The title, I think it's very long. I was saying before, I don't know how it got so long when I was writing it, but I've included a lot of buzzwords in it. But I think it kind of gives an idea of what I want to cover. I'm going to talk about some sort of characteristics I think are very important for working in sort of interdisciplinary projects of a very large nature. The types of projects that we think are really needed to tackle these very complex, upstream, hard to change societal challenges. I put out some ideas. I'm sure others will have their own reflections and ideas, and it'd be really good to hear them. So I'm going to try and speak for sort of 40 minutes or so, and then allow plenty of time for some conversation. I've got a note in front of me that I've said, don't waffle on, so I'm going to try not to waffle, but I might do anyway. So this is Bath. This is where I'm from. Bath is in the southwest of England, sort of near Bristol, those people know the country. And as you can maybe see from the picture, it's a beautiful city. It's got lots of limestone, sort of Georgian architecture, so 18th century buildings, these crescents, circular designs. It's a lovely place to live. It's a nice place to walk around. There's lots of parks. It's got lots of green spaces and sorts of things that are quite good for our health and well-being. It's a good example of how urban places can be good for us to help to make us healthy. But Bath also has its challenges in terms of its design. So these houses, they look really nice, but it's not that enjoyable being on the top floor of some of these buildings in 40-degree temperatures like we've had over the last few weeks. Bath's in a valley, and it's got a lot of cars. It's one of the most congested cities in Europe for traffic. And that means the pollution doesn't escape that well from the city. It was designed for horse and carts in sort of Victorian and Georgian times, not for modern transport. So we've had problems with sulfur dioxide pollution that we've had to introduce sort of air quality measures to manage. And so I think this is an example really of how cities can be really good for our health and well-being, but can also make us unwell. And that's really where a lot of my research is focused on. So my work is focused on this link between the urban environment and our health and well-being. So particularly focusing on non-communicable diseases. So the things we can't catch: cancers, respiratory diseases, cardiovascular diseases, mental health disorders. And there's lots of different ways that urban environments can affect our health. And so what I'm interested in from a research perspective is, well, how can we sort of change the upstream systems, policy, governance structures that affect how cities are developed and regenerated in order to sort of further on down the line improve health outcomes. And so I think these are sorts of research projects that I work on, and they are great examples, I think, of complex societal challenges. And I'm sure people will have their own definitions of what makes a complex societal challenge. I don't know if there's sort of a perfect definition. I've got my own here in the blue box. This is what I think makes sort of real complex challenges. I think they're important, right? They have significant consequences. So all of the climate change at the moment, we all know, I think, around how potentially climate change will have all sorts of consequences on health and social issues. They are systemic in nature, and they involve lots and lots of different sectors, lots of stakeholders, lots of different decision-making processes that sort of eventually lead to these outcomes. They're not a nice linear cause and effect, where we can easily say, well, that's the problem causing this. That's sort of at the heart of it. Instead, we often need to look across big, messy systems to understand problems. And they then will have lots of potential sort of things we can do about it, or solutions. But no one of those solutions on their own is going to solve the problem. We can think about solutions being something that can sort of shift the system to be better or worse, but not necessarily to solve it. And it's hard to change for all of those reasons. And often they're sort of deeply entrenched within systems. And essentially, it's really difficult to make a dent in it. And we've been trying to tackle these sorts of issues for a long time. With health inequalities, for example, this is not a new problem. Research and policy have been trying to address this. And there's great research that goes on to do things like improve urban environments. Someone was talking yesterday about work to improve some parks, for example. So there is brilliant research that goes on. It doesn't necessarily tackle the sort of root causes of these problems. So it makes it a bit better in a part of the system, but you're not necessarily changing sort of this to really tackle it, getting to the root of the challenge. And so we've seen over the last, I think it's certainly in the UK anyway, over the last decade, recognition that we need sort of new approaches in research to try and tackle these societal challenges. Kind of say, look, we've done lots of work in these areas. There are good things going on, but they're not really changing the system. And so this is an example from a group called the UK Prevention Research Partnership that was set up, I think, in about 2017. And there are other examples like this using similar sorts of language to talk about how we need new approaches to research if we're going to overcome these sorts of really big challenge spaces. And they emphasize, and there are a lot of words in here, and there's a lot of rhetoric. It says all the right things, but it's a bit of a word salad. But they talk about research that looks upstream, so it's trying to tackle root causes, not sort of downstream, immediate problems, but instead looking much back and looking at the system as a whole. They talk about involving expertise from many disciplines, which I'm sure is music to this group's ears. You need to bring lots of sectors together, and they put an emphasis on working together, not just having teams of different expertise, but bringing them together to find new methods, new approaches, and to develop new understandings. The idea is being, so far we haven't been able to solve these problems, so we need to think of new ways of working to really understand these problems from new perspectives and think of new solutions. And they emphasize the importance of co-production, so working across different sectors as part of teams. So an example of a type of research project that we've been working on that is in that space. It's not got as long a title as mine, but I think it's got a silly title, which we never agreed on as a team. Tackling root causes upstream of unhealthy urban development, or TRUD. We should have picked a different name because people call it TRUD a lot, which doesn't sound as good. But TRUD was funded by the UK PRP, UK Prevention Research Partnership. It was a £10 million project over 6 years, 6 universities, and around about 50 academics working on it. So a really large research project. And it was all about trying to change the urban development system in the UK. So the sort of the upstream system that produces, or the output of which is sort of urban planning and urban design, in order to sort of 10, 20 years down the line to improve public health. that was the idea of this. We did lots of projects like this, several of them, and being academics, we try and label everything. And so we tried to come up with a term that summarised what we think this type of project is. And we came up with this term limits, and I cringe slightly whenever I say it because I don't like it, but I'm going to try it anyway. And we use this term limits to mean research projects that are large in scale, mission-oriented, and inter or transdisciplinary in nature. Now, I think large scale and inter or transdisciplinary are fairly self-explanatory. Sure, we could argue about the details, and we do have arguments about what is interdisciplinary, what is transdisciplinary, what's a large scale project, all of those sorts of things. But I think the concepts are probably clear. Mission oriented, maybe less so. I don't know how familiar, some will be familiar, maybe some less. These bullet points are attempts to sort of to show what we mean by this, and it reflects what we think some funders are asking for. It's these sorts of projects that are looking to look upstream, take a systems approach to really get to the root cause of these complex problems, bring people together, integrating different disciplines, different methods, and co-producing all the work with different groups. Now, there's obviously big links here with any interdisciplinary work. I'm not claiming that we do something completely new. I think that the scale of it for us makes it something that is different on the previous interdisciplinary work that we've been involved in, and I'll try and illustrate that shortly. But absolutely, collaboration is sort of at the heart of what these projects are all about. And sort of I talk about the added value of them, and the reason we do that is because they are expensive. They are, they have to be well resourced if you want to bring teams like that together. They tend to take a lot of time and energy to set up and to run. And you're bringing in a lot of different stakeholders, people's time, and so they need to be effective, I suppose. And they do this by bringing together these diverse expertise. And the point is, when you're working in a really sort of complex system, a large system, the amount of expertise that requires is substantial. Urban development is an example of a very messy system, lots of sectors, lots of types of stakeholders, lots of expertise that you need. If you really want to understand that problem, then you need to engage with an awful lot of people and bring them together. But they have this focus on identifying new understandings, doing something different than we've done before. And we're saying that you can only really do that if you really collaborate together on methods and approaches. And that sounds great, and we're great at talking about this, saying we're all going to work together and it's going to be brilliant, and we're going to have some brilliant vision and we're all going to change everything. But of course, anyone familiar with doing these sorts of collaborations will know that they're really hard and really, really difficult for many different reasons. And so I think it's really interesting to think about what makes for a good sort of experience working in these sorts of projects, and how can we make the most. And so this is something we've been doing a lot on in the last few years. And here's just a lot of academic papers here. We publish these in different formats as well. But this is some of our research team and the work we've done that's been reflecting on this topic of how can you collaborate effectively in these very large, complex challenge spaces. And we've been fortunate to be funded as part of these projects to do some of this sort of critical reflection. We've had sort of meta-research strands to some of the projects where we've had groups of researchers whose job has been to understand how this collaboration is working, how can we do it better, things like that. And that's because the funders, at least some of them, recognise how important that is. Although, as I'll come on to talk about, there's a real challenge in getting support from the funders to actually do this work really well. So I'm going to draw on some of these for this talk. And these are the sorts of questions that I've been asking and we've been finding really interesting. So yes, thinking about what characteristics do researchers need to collaborate effectively. And here are my four that I've sort of put into the title of this presentation. And I don't claim this to be a perfect list. There's other things, and you could use different phrases. So I'm not it's not a perfect set, but it's what keeps coming up in some of our reflections. So I'm going to talk a bit about them today, but what I'm interested in is we can't put the burden on individuals, right, in these teams and collaborations. We can't sort of blame people individually for not having these attributes and for collaborations failing. Instead, we need to look at how teams can create the conditions for researchers to collaborate effectively, to demonstrate, to develop these sorts of characteristics and to generally thrive, because When you're working in these collaborations, it can be a great experience, and it could also be pretty terrible for people as well, for some of the reasons that I'll talk about. And then thinking further back, so how does academia as a whole enable or restrict these sorts of good collaborations? And I guess a bit of a spoiler, I think it generally restricts our ability to collaborate effectively. And I think there's lots of things that we could do differently to improve that. So these are sort of things I want to touch upon. So this picture is an attempt to show the range of expertise that's included within the Truth project. And actually, I haven't included it. It's not everything on here. The black blobs that basically represent different disciplines that researchers identified themselves, as in the lights to show how they thought they connected to others in the team. We did this in the first year of the project. If we'd done it at the end when the team was bigger, we'd have even more of a mess. And so I won't talk through it all, but you can see like a cluster of health people in there. This is about healthy urban development. So this was the team that we thought was needed to understand the urban development system in the UK and how you could change it to produce healthier environments. So yes, we've got people from health, but they're quite diverse as well. Health economics and public health overlaps, but also quite big differences. Just for example, we've got engineers, urban planners, people specialising in sort of law and regulation. If you want to change upstream process, you really need your law and public policy and governance people on board. We've got our sort of management, got people from sort of the world of finance and accounting, because private sector is incredibly dominant in the UK's development system. It's all funded through pension schemes, for example. I know nothing about pensions, so we need people with expertise in that area to be on board. Psychologists, architects, political scientists, and so on. And so I guess what I'm trying to say is this is a really big and diverse team from lots and lots of different disciplines. And of course, they have some similarities, but they also have lots of differences in how they do the same thing. And this will be familiar, right? So anyone who works across disciplines, I'm not saying anything that's new, but the scale limit, I think, might be in some cases. The idea being, if you want to investigate highly complex, hard to change places, you need to bring the right people together. And who are the right people? Well, it tends to cover a lot of different ground. So I'm just going to illustrate one example on this project about the sort of the challenges involved with all these different disciplines and how we try to overcome it. So the first part of this one project was aiming to understand the urban development system, right? And trying to get new understandings of the problem. We do that by collaborating, bringing together lots of different perspectives. So we all, from our individual disciplines, we've got an idea about how the system works and what needs to change. We don't want to use our individual ideas because we're saying that hasn't been enough so far. Instead, we want to bring all these different ideas together. And so we wanted to collaborate in a single qualitative study. We ended up doing 132 qualitative interviews, massive data set at the end. We wanted to understand barriers to creating healthier places and how we could change it broadly. That was like the aim of this work. And so we ended up with a large qualitative team. So 18 researchers across 9 different disciplines involved in this, and in different institutions as well. I'm not going to talk about the results of the study. If you're interested, well, there's an article that talks about this if you're interested in how to create healthy places. But I don't know, I'm sure there'll be lots of qualitative researchers here, and we all know the challenges of working with others on qualitative methods because there's lots of variation in how you do qualitative work, right? And there's really been big disagreements within disciplines. We can have different ideas, but when you're working across disciplines, you realise that those sort of norms about how you go about doing this sort of research, can vary hugely. And people have got real sort of it's red lines around how you do work, but it just varies so much. And so this was something that we had to battle with throughout and really identified a lot of tensions from start to finish. We had to think about what are the research questions? What do we want to find out? Well, how I ask those research questions might be very different from how somebody in school management might think about this. Someone in economics is going to have a slightly different interest than someone in architecture when understanding the system. So just agreeing research questions and what the purpose of this work was difficult. I won't talk through all of this, but I'll give you a couple of examples. Because what we were really worried about was we would end up disappearing into our own silence, and we'd end up just working on looking at this from our own perspective And that is not what we were funded to do, and that's not what we needed to do. So we needed to make sure we were all working together to kind of common study, common methods, so we'd end up with one big data set at the end of it. But people have got very different ideas about how you conduct interviews. So we have colleagues in real estate who said that in for them, they would use, and in their institution, they would use an elite interviewing approach, okay, which is a very well recognised method for doing qualitative research. But we had colleagues in other sectors who said, within my world, that is completely against what we would do. We don't like that term. We don't like that approach. And similarly, regarding sort of semi-structured or structured interview methods, do you go in with sort of prompts and tools to use in an interview? Really big difference. So we had to think about how can you sort of balance some of those tensions. Coding and doing analysis. I mean, we thought it would be hard, but we ended up with sort of 2-hour weekly meetings for a year while we were doing the analysis data set to make sure that we were all happy with what we were doing. I thought when I code qualitative data, I've always sort of coded sort of line by line, I guess. That's how we've done it. That's what I've been taught to do it. Others would say, we have people would say, you can only apply one code in a qualitative data set to a paragraph of text. And that's what we do. Some would say, everything should be double coded by 2 different coders, and then we should use quantitative methods to look at what they call intercoder reliability. So are we coding the same? And in fact, there's partners in from the management background saying, if we want to publish this data in our journals, we have to do that. We have to be able to show that level of that's rigor for their quantitative research. Public health colleagues saying, absolutely not. We're not doing that with this work. And so I think there's sort of tensions that came up, and this is where I can start to bring in those characteristics, thinking about humility as a really important one here. And being able to say, okay, this is how we do it in my world, but I understand that you do it differently. No, it probably sounds kind of obvious, but it's a real challenge, I guess, people to recognise that how you do it, how you've learned to do it, isn't the only way to do this work. Being adaptable, being able to say, okay, that's your preference. How will we make that work with what I'm doing? And these aren't things that come easily, I think, to people. And I've got to say, I don't know how many of our senior professors are here and senior academics, and say they were by far the worst at this. The amount of times we heard, I've been doing this 25, 30 years, and this is how we do it, as a starting point is not a productive start to a conversation about how to do methods, right? And so we talk about being positive. Don't mean just saying, oh, everything sounds wonderful, but it's about being able to recognise that other people's approaches are absolutely valid, seeing the positive in them. Don't just criticise what you hear. But a lot of times when research would raise a concern, someone would just dismiss it because that's what they've been trained to do in their own space. And so we had to find ways to try and to overcome these challenges. So we came up with some recommendations for sort of working in this type of space. And again, there's a paper link. I feel this is your thing, about how we did this study. We talked a lot about having to sort of find this balance between allowing researchers their own sort of autonomy and choice over methods and what to do, as well as sort of ensuring collaboration and making sure that we were all following a common purpose and common method. I won't talk through all of these, but I'll highlight a couple. Number 2, acknowledging that there's no single right way of doing it. I've sort of mentioned this already, but being really clear about this from the very start, establishing that almost as a rule for conversations, getting people on board with that idea we found to be very helpful. There were lots of conversations yesterday that heard around this idea of creating kind of what I call it inclusive environments. People talked about psychological safety in terms like that, right? So again, nothing new here, but establishing these types of like environments where people feel comfortable being able to raise concerns, but being able to do it in a constructive way. So again, thinking about sort of how you could do that in a sort of a positive approach. Number 5, allowing timing. This stuff takes time. It's one of the challenges of collaboration, right? It takes a lot more time. We could have just gone into our silos and done this study fairly quickly, but then we would have ended up with a mess at the end of it. It wouldn't have been able to put it together. We wouldn't have got what we thought of these sort of standards. But being prepared to change direction, I think, is really important. So we can start to think about resilience, because it's a challenge to be able to say, we've tried this, because we're doing something new, and you're trying to do something new, there's a good chance it's not going to work, I think. So being able to understand that it's not working and confident to say, we need to try and do something different. So again, establishing this with a team and making people feel comfortable being able to do that, just let them know that's kind of okay. But of course, it's never that simple, I think. And it links to a broader point about this type of research where you are putting people outside of their comfort zone. Like, I'm not used to working with architects and engineers, and I am now, but I wasn't. And they would come up with models and ideas, and I'm like, well, I don't really understand this. I'm not sure this is going to be the right approach. But then recognizing that we have to be outside our comfort zone if we're going to do this work. Okay, having that humility to be able to say, well, okay, my approach is one way, their approach is something else. Let's see if we could find a way to combine these and work together. And there is risk involved in all of this. And that's the point of this research. It's supposed to be taking a risk, doing something new. It's by doing that, that's where you're going to make progress. And we talk a lot in these projects about, are we prepared to fail? Okay. And in my experience at the start of the project, everyone's very bullish and everyone says, absolutely, if this doesn't work, it's okay, because it's what we've been asked to do. It's a hard space to work in. Come forward 2 years and your research fund is starting to say, well, what's going on? What are you producing? Your institutions are saying, where's the papers coming out of this? You need to do your apply for promotions and you need to have outputs. People become a little bit less confident about being prepared to fail, actually. And there's a risk then that we go back into our sort of what we know in order to, we've heard a lot about, we should just get something done. Can we just hit the, to use a very English phrase, pick the low hanging fruit, get something done that is low risk? But that's kind of moving away from the principles of what we were trying to do in these projects. And so getting people comfortable with taking chances and feeling resilient if it's not working, I think is really important. So I've talked a bit about working across disciplines. We can also talk about working across sectors with non-academics, the idea of co-production. These are two different models of co-production that broadly do the same thing. The one on the left is from public health, and our public health colleagues would said on those projects, let's use this. This is how we do co-production. The one on the right, it comes from sort of engineering world and software development. And actually, they're really simple. They just use very different language. They're presented differently. But what we would find is that one set of colleagues say, let's use this model. And say, well, no, let's just use this one. And then someone else will come in and say, well, no, I think we should use something completely different. We're all on board with the idea of doing co-production, I think. But how we would do it was just another area where people have very different ideas. So again, being able to accept that others have got good ideas and being able to be open to trying them and thinking about how you can integrate them with your own is really, it's hard, but it's really important. So we would do things like introduce a sort of rules meetings where if you were going to sort of dismiss someone else's model and say, here, use this one, we sort of say you had to be able to kind of to say, what is it about that model that doesn't work compared to what you're offering, and how can you put them together? The idea was to put things together to come up with something new rather than use any one discipline's preferences. But all this stuff takes time. So let's talk through all of the differences, try and understand them. Like, I don't look at that V model and instantly understand it. It's not my world. It's just not the language I would use. So it's quite frustrating for our engineers. They would say, no, just use this, it's perfect. And I just don't really understand it. You're alienating people in the team by insisting that your one is the right one. So again, we're on to our sort of our themes of humility and adaptivity and so on. And we spent a lot of time talking about this question of what is co-production. We're all on board with it, but very different feelings across the team about what it means to do good co-production in terms of who you should be involving. For some of our team, it was about the public, right? It's about involving the public in your work. And for some, that was the extent of it. For others, it was about involving policymakers and practitioners. And of course, for some of us, all of these. And when do you do it is a really important question, because when you're working in big, complex systems, you often don't know at the start of your project where you're going to go with it. So you don't know the direction of the research. To the point, if you did, you wouldn't need to do the understanding process. So you spend a lot of time trying to work out where in this system should we be trying to make a change. And the consequence of that, you don't really know necessarily who to involve. Because the image on the right it's a set of stakeholders that we found to be really important for understanding urban developments. And they cover lots of different sectors and subsectors. And so no one of them understands the system as a whole. So how do you bring them into the first public research? Can you bring all of them in, is the question. Principles of co-production and these projects was to involve all those who need to be involved. And that sounds great, but it's incredibly difficult when you're talking about sort of really large systems and potentially hundreds and hundreds of different types of stakeholders. Practically, it's just challenging. So we had to sort of challenge our own ideas of what it means to do co-production and how I think about co-production in some of the research I've done before. For example, lots of work on working in prisons on prison-based drug services and harm reduction services and things like that. Not easy, but it was fairly straightforward to know who we probably should bring into that process. It's a much smaller group of people than here. So I had to slightly question my own understandings of what co-production is. This paper was probably the hardest one we've had to write. There were fallings out within the team that I better not go into, but really strong views of what it means to do things like co-production. It's an area people feel very passionately about, I think. So again, being able to step back and sort of think about how does my prior understandings feed into a project like this. And as I've said, a real challenge of this type of research is that it is very messy and there's a lot more uncertainty involved than in lots of types of research, I think. You don't know when you start the direction it's going to go in, or you shouldn't do, because that's the point. But we all come in with our preconceptions. So our colleagues in economics, they would say at the start, this is what this project's about, this is what we're going to want to do. If you ask someone in public health, they would say something differently. If you asked our real estate urban planning teams, they would say something different as well. So then we had like an established sort of mission, if you like, an idea of what we were trying to do. It took 3 years in that true project to understand exactly what it was, where we were going to be intervening, what were we going to be trying to change. And that creates a lot of uncertainty, I think, as a researcher, because you're kind of used to knowing what it is you're going to be doing, and now we don't. And again, this idea of resilience, I think, is really important to help people to feel like it's okay not to know at the start what the research is going to be doing. Not sure again how well that matches our funders. So for our funders who ask us to do these type of projects, when we apply for the money, they want to know exactly what you're going to do for the whole project and the timeline and what you're going to produce at the end of it. We have to say, well, we don't know, because you've asked us to spend the first couple of years finding that out, but they want certainty as well. And so we end up, what we've seen is that the applications end up sounding like you really know what it is you're going to be doing. That makes the team feel like everyone knows what to do. And then you start and people realise it's going off in different directions. It's not what you said you're going to do. And so there's a lot of work to be done there around establishing sort of clarity where you can, but helping people to manage those feelings of uncertainty. And this came up a lot in sort of research on research work that we did, and say this is just an extract from one of our research articles that looked at sort of how to help teams to how we sort of operationalized our research programs. And what we found was a lot of our researchers in the team would feed back that they found the lack of kind of what they saw as a lack of clarity and direction a real problem. And actually this idea of uncertainty around what we were doing was seen as a real negative. And people didn't like it. And actually some of our researchers did experience sort of poor well-being themselves during the project. They found this very stressful, because they were being asked by their departments, well, what are you doing? What are you producing through this? The partners on the project saying, what's going on? They weren't able to give that clarity. And it takes longer to produce outputs as well as a result, which doesn't fit with how academia wants to work a lot of the time. So I like this model because when we work in sort of systems, everything's really confusing and all the graphics we produce are really confusing. This is one that I think is quite straightforward, so I'm very pleased with it. I don't know why with these colours, it's terrible when you're on the screen. It should be more yellow. And this just represents how the approach that we try to take in these projects to get certainty. And so you do start off with a bit of a mess. Everything's on the table to start, because we're not going in with assumptions. That's important, right? We want to collaborate to come up with our ideas and our understandings. But over time, we move from this idea of everything on the table through to, at the end, a much smaller space that we're going to be working in. And that's what that's when you get that certainty. It just takes a lot of time. And so I use pictures like this at the start of projects to try and help the team feel like it's okay not to know at the start. Keep reinforcing that message. I think it's really important. Don't know what to call this. To call it an avocado model. I'm not sure about that. It's too many layers. Come up with something. And I think it is worth just highlighting this. Sorry, there's detail here that you don't need to know, but the benefits of these types of projects can be massive when they're done well. So this is just one part of an output that we've produced with this research. So we work with national government in the UK, and we've essentially brought about changing guidance. So when our government decides what when they make decisions about what funding to give out for urban development programs, talking billions of pounds of research funding, they're using a health economic evaluation model we introduced in this project to help make those decisions. Now, it's not going to solve the problem of unhealthy urban development, but it's addressing one gap, which is that health was not previously part of those decisions around what to fund nationally and whatnot, and now it will be. So that's a bit of a win for us, but it's been really hard fought. So this is just a table of the types, sorry, there's acronyms on here, but the types of stakeholders we've engaged with just on this part of the project. And it's because of urban development, it covers the Department of Health, it covers the housing department, it covers the environment department and treasury. And we've had so much time with these stakeholders over a period in order to get this work over the line. 172 meetings just with our national government partners in 2.5 years. And that just illustrates that these are really hard things to change. It also illustrates how the UK sort of civil service works, I think. Well, they do love a meeting and they don't necessarily love doing things after those meetings. But I think, again, talk about resilience, you need resilience to work on these projects. It's slow moving because they're hard to change. I need to finish up. I haven't waffled too much about it, so that's good. With some sort of just reflections from all of this. And again, I've talked about this just then, but there are loads of benefits from doing these type of projects. Like, yes, they're hard, but there's lots of benefits from doing it. And I reflect on my own work and the sort of policy impacts we're able to have and the work we're able to do as a result. All the sort of knowledge and skills you get from working in these types of teams really across disciplines be fantastic. And I think that as a result, I'm a better researcher. It's hard to talk about the importance of being humble and then saying, I think I'm more humble as a result. But I do think I've improved my own sort of research abilities through doing this. But a few kind of, I guess, caveats around this. I think there's a real risk that only some researchers get the benefits in these types of collaborations. And I think it's not a reflection on individuals. It's just, for some, it probably depends a lot on your sort of level, your experience going into them, the sort of line management systems you've got, the team, sort of sub-teams that you're working in are really important, I think. And we've seen cases of researchers having to leave projects because they find them very hard to work in. They get criticism from academics. Love to criticize others, right? We love to critique other people's work. And when you're getting that from sort of 9 or 10 senior academics who are looking at everything that's coming out of it, they're all saying, well, I wouldn't do it like that. That's quite hard, particularly for early career researchers. So again, we can think about positivity in terms of how we give feedback and how we talk to others. I do think there's this real role for research leaders in creating the conditions where we can be humble and adaptive and positive and so on. And I'll share some final thoughts on that in a moment. And I do think that, funders and our research institutions that work in, we do talk a good game on this. They say all the right things about how we should be supporting good interdisciplinary and transdisciplinary work. Talk about we need work that has real world policy impact, whatever that means to us. But I don't think in lots of ways they're enabling this, at least in my experience working mainly in UK institutions. And I think they could do a lot more. And I've highlighted a couple of issues there already, but I'll just finish with a couple more. I've talked about topic of humility a lot. I do think as research leaders and senior academics, it's incredibly important to establish those norms, actually, and sort of openly stating projects. I don't know. It's really helpful for people to hear that. Just seeing people saying, I don't have the answers, and I don't know where this project's going to go, and I don't know what the best method is. Just because I've been doing it that way for all these decades doesn't mean it's right. I think that we can try and provide clarity on the direction of projects to an extent. We have to recognise that it's not always possible when you're working on these types of So there is something to be said for trying to build in people's confidence in not knowing what's going to happen and our resilience to projects going wrong and taking longer than they were expected. Because all of these projects I've worked on like this have taken a lot longer than we anticipated to get to a point where we knew what they were going to do. The keynote yesterday spoke about this, so I don't just talk about being kind. It comes from the love all the time. I think it's so important, particularly again thinking of earlier career researchers who are sort of at the heart of all of these studies, these research projects, doing all the hard graft on. It's really hard for them when you've got under pressure academics responding to them and often quite negatively because they're under pressure and these projects are hard and difficult. So always keeping this kind of, we recognise it's not easy always to be positive ourselves and to show humility, but it's really important. And I think for funders, fundamental point is around allowing more time and resource for doing this sort of collaborative work. So we always put into funding bids, we'll say, look, we need time to establish psychological safety. We need time for us to talk through our differences. But these are the first things that we're asked to remove from our funding applications to reduce the cost of them. So you want us to do these collaborations, but you're not really setting yourself to succeed in them. You take them out and then 2 years later, we're left kind of thinking that we didn't do enough early on to help build these, help to come to these shared understandings and to establish these type of principles that I've been talking about. And finally, I think for academia as a whole, the way we incentivize these sorts of collaborations, doing good co-production. I don't know, I'm thinking of, for example, publishing. We have colleagues from some disciplines on these projects who say, if I want to publish, I need to publish these journals for my CV to get jobs in my department later. Well, I can only have 1 or 2 authors on these publications. That's really hard to do when you're in a team of 20 people who are saying, well, we've all contributed to this study. We've included you on our paper, but you're not going to include you on ours. Now we've got our tension and our fallouts that you see. I think that things like that, and we all need to do certain things in order to progress in our own disciplines. And someone said yesterday in one of the sessions something around that they ended up feeling like they didn't really sit in any discipline, so they did something else instead. I think that's really common for earlier career researchers working on these types of projects. They develop all these skills, methods, and ideas, but they don't really then sit in their own departments. And so, and I'm sure that some of these are familiar to people. So that's really my reflections. I've been really keen to hear what others think today or in the future. But for now, yeah, thank you very much for listening. And So I think it's okay. very much.